December 7th is the hard deadline for Medicare Open Enrollment. For a lot of people, letting the clock run out and automatically keeping their current plan feels like the safest, easiest option. But on January 1st, the plan you have today disappears. Insurance companies aggressively rewrite their contracts every year. Your doctor networks, your covered medications, and monthly premiums all reset. If you assume your coverage remains identical without checking the new terms, you risk showing up at the pharmacy in January to find your daily medication costs have tripled, or visiting your specialist only to realize they are suddenly out of network. Let's look at this chart mapping out your options. When you choose passive auto-renewal, you aren't saving time. You are making a blind gamble with your healthcare access. Doing absolutely nothing drops right here into the high-risk, low-effort zone. Failing to review your plan before the deadline leaves your fixed income exposed to massive, unexpected medical bills. Your first layer of defense actually arrives by September 30th. It's called the Annual Notice of Change, or ANOC letter. Reading this document immediately tells you exactly what deductibles or copays are shifting. It gives you a 2-week head start to map out a strategy before the October enrollment rush begins. Comparing dozens of Medicare plans can easily trigger decision fatigue. Instead of a weeks-long research project, you can protect yourself by working through a specific 10-question checklist that targets the most common coverage gaps. To answer those 10 questions, you need 3 specific inputs sitting right in front of you: a complete list of your current medications, their exact dosages, and a list of every doctor you see regularly. Once you lock down those variables, you stop guessing. You can plug your specific data into Medicare's Plan Finder and turn an overwhelming choice into a clear, side-by-side math problem. Taking 5 minutes of friction to gather your actual pill bottles and provider cards right now prevents thousands of dollars in unexpected medical bills next year. When evaluating those plans, using last year's provider directory is a critical error. Specialists and hospital networks reset entirely every January. Do not trust a plan's published online directory. They often lag behind real-time contract changes. Call your specialist's billing offices directly and ask if they are in-network for the specific plan you are considering next year. The exact same logic applies to your prescriptions. A plan might say it still covers your medication, but that doesn't mean it covers it at the same price. Insurance companies use drug tiers. A medication can stay on the approved list, but quietly get bumped from a low-cost preferred tier up to a highly expensive non-preferred tier. When that happens, it is technically still covered, but your out-of-pocket copay spikes dramatically. Run your entire prescription list through Medicare.gov's Plan Finder tool. Enter the exact dosages to catch these hidden tier changes before you commit to a plan. Confirming your specific doctors are in network and your exact drug tiers haven't jumped is the single most effective way to protect a fixed income. You will see endless marketing for zero-premium Medicare Advantage plans, but a $0 premium does not mean $0 healthcare. This matrix shows the only metric that matters: total estimated annual cost. That's your premium plus expected deductibles plus realistic copays. Factor in moderate usage, and the zero-premium plan compensates with much higher specialist copays and deductibles, making its total cost significantly higher than a plan charging a modest fee. The math only works if you are honest with yourself about your health. Projecting your actual visits and procedures is the only way to calculate what a plan will truly cost you by December. Selecting coverage based solely on the appeal of a $0 monthly premium is a mathematically flawed strategy that frequently traps people in crushing back-end costs. You also need to audit the quality of the insurance carrier. Medicare recalculates Advantage plan star ratings every year based on actual patient outcomes and customer service. If your plan drops by a full star or more, that indicates a measurable decline in care coordination and claim approvals, even if the price looks identical on paper. Depending on how your health or travel patterns have shifted this year, you should also weigh the larger structural decision of staying in Medicare Advantage versus returning to Original Medicare. If you do attempt to switch to Original Medicare and add a Medigap policy outside your initial enrollment window, you face strict state regulations. In most states, insurers can apply medical underwriting to your application. This means you lose your guaranteed issue rights, and they can legally deny your coverage based on pre-existing conditions. Auditing your plan's star rating and understanding your state's specific Medigap rules secures your long-term access to reliable care, rather than just chasing short-term premium savings. If you are an adult proxy caregiver managing this decision for a parent or spouse, the audit process requires a few specific steps. You cannot finalize a switch on your own. You must gather their specific Medicare member, exact medication dosages, and ensure you have documented authorized consent on file with the plan. For those who have moved out of their plan's service area or lost other creditable coverage this year, you may trigger a special enrollment period. This decision tree shows how a special enrollment period works. It allows you to skip the standard fall waiting period, but it introduces immediate hidden deadlines. A qualifying life event triggers a strict 60-day window to lock in new coverage. If you miss that window and create a gap in your Part B or Part D coverage, you will be hit with permanent late enrollment penalties that increase your premiums for the rest of your life. Whether you are acting for yourself or a parent, missing these hidden deadlines or loyalty windows permanently damages your long-term financial security. The final step of the audit is execution. You must officially submit your plan change before the hard December 7th deadline. If you decide to switch, keep your old insurance cards and plan information handy to resolve any lingering medical claims from November and December. But what if you ran the entire 10-question audit and the math proves that staying with your current plan is actually your best option? Write down the exact date you ran your numbers and your specific reasons for staying put. Having this physical record prevents you from second-guessing yourself or Mary searching when next fall rolls around. Then, set a recurring calendar reminder for late September to look for your new annual notice of change letter in the mail. By replacing decision fatigue with a mathematical audit, you ensure your coverage for next year is an intentional choice based on your actual health needs.